You imposed the school mask mandate after Governor Cooper, whose administration you work for, vetoed a bill that would have required in-person schooling. You've also spoken publicly that you made decisions on whether to allow fans to attend football games or whether to lift mask mandates based on feelings and what your friends at other state public health agencies were doing. None of this suggests that you will push for the much-needed changes at CDC or help the agency break from its insular culture. I'd like to ask you if you have any regrets about the school closures, the mask mandates, or any other restrictive measures you imposed in North Carolina.
Well, thank you, Representative Denton. I'm very proud of the work that we did in North Carolina. I feel like we did that in a way that was very inclusive. We listened. I had great partners on both sides of the aisle in North Carolina as we did that work. You have to put yourself back in 2020 when we had very little information. We barely had any tests. We had very little PPE. We certainly didn't have vaccines or treatment. There were very few tools at our disposal to protect folks.
Would you impose those type restrictions today?
Well, the good news is we're in a new place. So, right, and I'm looking forward to turning this new chapter with CDC as we look forward. I want to make sure we're learning the lessons from the pandemic about transparency and about creating those infrastructures that we need to make sure that we can detect and respond to diseases. But I want to make sure that we are in a place where we don't have to get into that place again, right? So we are detecting.
We trust the science and not the feelings and the opinions. A lot of it was subjective, 6-foot social distancing and all this. But anyway, moving on. We had a hearing at CDC on CDC reform back in June, just after the COVID-19 public health emergency declaration was finally terminated. Some of the major takeaways I had from that hearing is that CDC is much too academic, too insular, and does too much. To be fair to you and the CDC, a lot of these failings have their roots here in Congress. CDC has never been authorized as a coherent agency. We in Congress have never told the CDC definitively what it's supposed to do and what it isn't supposed to do. This has led to mission creep, and a CDC that is an agency of all trades but master of none. So I think the lack of underlying authorization is the root of a lot of CDC's problems. We in Congress need to revisit CDC's authorities to impose mask mandates and vaccine mandates. Some of these statutes date back decades and were originally given to the Surgeon General, who is now just sort of a glorified spokesman for the nation. These authorities are totally out of date and prior to COVID-19 were thankfully seldom utilized and never at the scale we just experienced.
Without a doubt, public confidence in the CDC has been tremendously damaged by the actions of multiple directives, directors, and choices made within CDC leadership. For example, at one point in time, CDC Director Redfield said that masks could offer more protection than vaccines. And of course, we now have scientific evidence that proves masks do very little to prevent transmission of COVID-19. And certainly we can dive into vaccine efficacy issues and questionable studies that were used to justify draconian lockdowns. But it's clear that the CDC has a very long road ahead to reestablish credibility and regain the trust of the American people. Sometimes those external advisory councils give recommendations that are contrary to the administration's political agenda. Have you adopted any of the external committee's recommendations, or have you gone against those recommendations?
Well, thank you so much. Under my tenure, I believe you're referring to our external
Yes.
ACIP committee. Yes, they've met a number of times. We actually have new vaccines for the first time in history, so they had to meet for that. They met for the updated COVID vaccine, the RSV vaccine, and all made recommendations for the vaccines that we then adopted.
So certainly there have been some troubling things coming out in recent years, particularly at the height of the pandemic, where members of that external advisory committee were fired for presenting an opinion that was contrary to the political agenda of the White House. In a situation where one of your advisory members presents a divergent opinion, are you taking that into consideration, or are you simply firing these people?
So I'm not familiar with a situation where folks were fired. The way the ACIP works, they have a certain tenure, they serve for that tenure, and they do roll off, and we do choose additional new members. And we appreciate, that these independent advisory committees advise CDC on this work, and I think they're an important component of how we're reviewing vaccines and our recommendations.
Okay, I was actually referencing Dr. Martin Kulldorff. He was let go, and this was very recent, again, at the height of the pandemic, and I think that there should be a formal review of how that all transpired, because I think that has a direct impact on the guidance that then becomes issued in public from the CDC. At this time, I'd like you to take a look at the screen for me. There is a screenshot we have here a sampling of dozens of errors within the data that the CDC was using to justify their positions during the pandemic. These errors excessively exaggerated the COVID risk to children, for example. One of the most damning errors was that the CDC repeated for over a month that COVID was a top 5 cause of death for children. It took months for the CDC to correct this statistical error. Now, during the course of those months, millions of taxpayer dollars were spent to promote the vaccine for children just because a basic data point was incorrect. Now, how do you plan to rectify this? Because quite frankly, if the CDC can't get basic data points correct, the credibility will never be restored within this institution. And also, children who really there was no scientific justification for them receiving the vaccine could potentially, and we have seen documented cases where they have vaccine injuries as a result of that being pushed on them and their parents feeling pressure from the CDC. So can you speak to these errors and how you plan to address these basic errors that have been documented over the past 3 years?
Well, Congressman, I appreciate this, the first time I'm seeing, so let me review and we can follow up. But what I would say is 1,700 kids have died of COVID. But let me tell you what I have done for my own daughters who are 9 and 11. I got them the original COVID vaccines, and just a few weeks ago they got the updated COVID vaccine. It's because I've looked at the data, and I think that these are vaccines that the safety profile is there in terms of safety, and they are very effective at making sure that our kids are protected. I don't want them to either get into the hospital, nor do I want them to get long COVID. So I got my own kids vaccinated, and so I'm happy to look at this data, but I wanted to at least share how I made a decision as a mom for my own kids.
Well, and I know my time has expired, but I would love to have in writing from you a detail of the threat that COVID presents to children and young adults under the age of 18. I'm sure you probably have that off the top of your head if you can provide us that number.
You can get that to us later. I appreciate it. The gentlelady's time is up. Now I recognize Ms. Miller Meeks of Iowa.
I have been told that while you served as the Secretary of the North Carolina Department of Health and Human Services, you were a staunch proponent of vaccine mandates, extending school closures, and business lockdowns and closures. Is what I have been told accurate? And if so, how do we know you won't support government mandates at the federal level?
Well, thank you, Representative Lesko. And, I appreciate that we're looking forward. We want to turn that new chapter. I think there are a lot of lessons learned from the pandemic. We've been talking about them today. And you have to remember, at different moments in time, we needed different solutions. And the good news is we are in a different place. And we can look forward as we go to make sure that we are building the national security asset that we need. And so we want to use tools that protect folks' health. Vaccines are a very important tool to protect folks' health. It's why I've been traveling around the country sharing that. But I am trying to take those lessons learned, apply them, and move us forward.
Well, hopefully you'll take those lessons if another pandemic breaks out while you're still the director. Because I oppose government mandates. I myself took the vaccinations, but I don't think it should be forced on people. And with that in mind, do you think that the government mandating vaccine mandates, it actually did the opposite effect and made people more hesitant to take them?
Well, I think vaccines are a critical tool to keeping folks healthy and safe. And it's not just the COVID vaccine, it's flu, it's all of the vaccines that have kept children and people safe for many, many decades. I think they continue to be really important tools. And I look forward to working with Congress to make sure that we can get good information to folks so that they can make the choices for themselves to use tools to protect themselves.
Well, I can tell you from personal experience talking to many constituents, the mandates actually had the opposite effect on people. Less people want to take vaccines. I think it's a better approach to encourage people to take vaccines, not to force it on them from the government, because then people just will distrust it. Not all people, but a lot of people. My other question is, do you believe that wearing cloth masks or the surgical mask, I'm not talking about the N95 mask, the surgical mask prevented people from getting COVID?
Well, thanks for that question. We know that masks work. They do work, the surgical masks work to make sure that you're protecting you, the individual, from circulating viruses. So they do work. And again, at different points in time, they were some of our only tools that we had before we had reliable tests or treatment or vaccines. But they are still a tool that we can use. But don't forget washing hands, ventilation. We learned a lot during the pandemic. We need to use all those tools.
So you believe that some of those cloth masks that people had, where the openings and the cloth is bigger than the molecules of the COVID vaccine, actually prevented people from getting COVID?
Well, so surgical masks are certainly better, and N95s go, even better than that. But cloth masks still provided some barrier to folks, but that's not, when CDC makes its recommendations about what kind of mask to wear, we say wear a well-fitting, appropriate mask, yes.
I hope that the government balances the benefits versus, for instance, in school children, having all school children mandated to wear masks when perhaps those masks' benefit did not outweigh the negatives of children not being able to see lips moving or expressions and that type of thing. Thank you.
Thank you.
Go ahead.
Oh, I was going to say that is where we relied on the American Academy of Pediatrics related to safety of masks for kids, and they continue to say that continues to be a tool that we can use to make sure folks are protecting themselves.
In addition to being a member of the Energy and Commerce Committee, I serve on the Select Committee on China. The Select Committee recently published a bombshell bipartisan report. You're aware of it. You've said on the illegal biolab that was discovered in Reedley, California. This warehouse was located in the center of a small town just across the street from an elementary school and a block down from the city hall. The clandestine, they're calling it a biolab, was a disaster waiting to happen. The CDC's response, or rather the lack of response, clearly endangered millions of Americans. And there were a couple of things that really stood out to me. The first is that the CDC's Select Agent Program completely failed the people of Reedley, California. The CDC literally refused. They did not respond when they were requested. They responded months later, and only when Congressman Costa made that request. To come to the town and assess the situation. The discovery, I remind you, was made by a housing code inspector who was tracing a garden hose that went in a window. That's how this was found. It took a phone call from Costa to get there finally. Once the CDC arrived, months after the first request, the investigation he conducted was completely unprofessional and inadequate. And I say that as a professional in the field. The CDC didn't test one vial, even the ones that were labeled tuberculosis, SARS-CoV-2, and Ebola. An entire refrigerator labeled Ebola. That is a select federal agent, by the way, and HIV was there. This facility is completely unlicensed warehouse, no licensing whatsoever. Over 20 potential pathogens, 1,000 transgenic mice, humanized. There were 0 isolation facilities that would be necessary to either legally or safely handle these agents. And perhaps most egregious and simple-minded, the agency didn't even bother to translate the Chinese labels. There were some vials that had only Chinese labels. Didn't even ask for a translation on this. Amazing. When local officials started to dispose of these materials, they asked CDC what to do with the Ebola. Again, a federal select agent. And a CDC branch chief, I have these emails I'd like to submit for the record.
Without objection?
Thank you. CDC branch chief belatedly responded saying, we don't see an urgent need to test these samples at the moment. Most of the material we identified was not considered a serious threat to public health. HIV, SARS-CoV-2, hepatitis, malaria, and Ebola, not considered a serious threat to public health. the conclusion made by the experts at CDC that a refrigerator labeled Ebola was unlikely to contain Ebola. And you look at the totality of this situation, it reads like a nightmare, a horror story. In what world is this okay? How do you expect the American people to take our public health institutions seriously when this is their reaction to a very real situation? CDC should not ignore pleas from local public health. And by the way, the California Public Health Service asked them to sample this stuff too. The CDC should test substances if requested by local governments. Surely that meets a threshold test. And I'd like you to explain, is the CDC supposed to be the first line of defense for human infection agents in the United States?
Well, thank you, Congressman, for the opportunity to respond. There were a number of inaccuracies in that report, and so I want to make sure you know that when we were asked and invited by the leaders of that investigation, FBI, FDA, state and local officials, we did deploy. We did look at, we were there for a 2.5-day investigation, and we did not see any evidence of select agents. Not only did we look at all of the paperwork, the vials, the freezers,
Let me, just because we're running out of time, let me reclaim it. Yes, they responded, but they did not respond when they were first requested. They responded months later.
So
I mean, and we have that on, I mean, we had that examined by the FBI. It came to our committee and told us that. That's who we got that information from. If you have better information than the FBI, you need to let us know.
Great. We would be happy to share the more about the timeline, but when we were asked, we did deploy no select agents on site there, and we continue.
You know, you didn't test for anything.
Well, so right, this is where our experts did a 2.5-day review. I want to address what you were talking about related to Ebola. When we heard after the fact that someone said something was labeled Ebola, we took 300 pictures. We did not see one bit of evidence.
It was on the front of a refrigerator.
We didn't see that. We asked folks to say, do you have a picture of that? Could we validate that for someone else? No one could validate that for us. So, you know,
So we just blow off the California Public Health Department and say, oh, we don't believe you. You know, obviously my time is expired, Mr. Chairman. I have to tell you, though, in my professional career in biological warfare, I have never seen anything like this. By the way, the worst concern I have, this may not be the only one. This is one that a housing code inspector found.
Georgia, Mr. Carter, for his 5 minutes of questioning.
Thank you, Mr. Chairman, for allowing me to wave on to this committee and to this important hearing. Dr. Cohen, thank you for being here. It seems that there's been a shift in the CDC toward addressing broader societal issues like climate change and social detriments of health, and I'm very concerned about that. You know, you've heard today the trust in CDC, not only from Congress, but in the general public, and you know this. You haven't been living in a shell. You understand that the trust, the public trust, is lacking right now. We want to help. We're not here to pile on. We're not here to beat you up. We need to help. But I'm concerned now that you're biting off more than you can chew. What's up with this? What's up with these? You know, what's has your mission changed? All of a sudden now you're going to bite off more than you can chew and talk about these issues? Like, I mean, your mission beyond, has it expanded beyond communicable disease detection, investigation, outbreak control into areas such as non-communicable diseases, injury prevention, climate change, social detriments of health?
Well, thank you, Congressman Carter, and thank you for, you know, obviously CDC being located in Georgia. Appreciate your support of CDC and our work. And look, we have a number of health threats that are at our doorstep. Many of them are infectious disease, many of them are not. I look at too many suicides, too many overdoses. The heat.
I would call those mental health issues, so I beg to differ on that. So I'm not, that's not what I'm talking about.
Okay, sorry, then please happy to have you clarify.
Well, I mean, which agency in the federal government do you think is more qualified or more prepared to deal with climate change, the EPD or the EPA, the Environmental Protection Agency, or the CDC?
Well, specifically related to health and heat. I mean, there are many health impacts of heat that we are understanding more and more. And what CDC is great at is bringing data and evidence and best practices to some of this. Again, whether it's suicide or whether it's how things like heat or wildfires are affecting people's health. We need to have that data and evidence so that our health delivery system and others know how to react to protect.
But do you think the CDC's got too many missions, or not enough? Are you looking for more, or what?
Well, we do need to make sure we have the
I
resources.
mean, my hope, and I think the hope of the committee and the hope of Congress and the hope of the public is that you focus on what you need to be doing and that you do it well. I mean, obviously, if we have another pandemic, we don't want to see the same mistakes that we saw during this last one.
Well, Representative Carter, we agree on that. We need to learn the lessons from the pandemic. I agree on focus and prioritization. I think we need to make sure we have risk-based prioritization of what we're doing. There are so many health threats out. We can't possibly tackle them all. We have to be prioritized in doing that. But those are infectious and non-infectious in those health threats. We don't want people in our country dying sooner than seeing early deaths.
Okay, look, I'm not trying to belabor this, but what about deforestation? I mean, that's affecting the environment. How many foresters have you got at CDC?
Ooh, I don't know the answer to that.
You think you have any?
I don't know. I don't think so. But
I
don't
hope
know.
you don't.
I don't know.
Well, I hope you understand my point. My point is that we want you to focus. We want you to get it right. And we want you to make sure that you're fulfilling your mission and not trying to expand beyond your mission. I mean, obviously, we want you to do well. We want you to succeed. But at the same time, you're not going to be able to do that if you broaden into these other things that are getting so much criticism.
Well, I appreciate wanting to work together on that important mission. And again, some of the things we've been talking about to make sure we have the infrastructure needed, workforce response, our lab capacity. I think we're all talking about the same things. I do want to make sure, though, we have the ability to address some of these health issues upstream. I know, particularly your clinical background, we spend a lot of time in different committees talking about the expense of chronic diseases and how much money we spend in Medicare and others on diseases that we know can be prevented. We need to do the research and know the best practices so that we can be preventing these diseases like diabetes before
Okay,
we're paying
fair
on it
enough,
in the
fair
back
enough.
end.
One last question before I let you go, okay? Next to getting to move to the state of Georgia where the CDC is located, what's the greatest thing that ever happened in your life?
Thank you. Well, I'm grateful to be in the state of Georgia. I do miss North Carolina. That will always have my heart, but it's been great to be at the CDC campus, and thank you for your support.
Thank you, and I yield back.
What assurances can you provide us that there are appropriate checks and balances between the CDC and the CDC Foundation, especially when it comes to transparency?
Well, thank you, Chairman. Transparency is very important to me, and I'm working hard to make sure that we can collaborate with many partners. As you likely know, the CDC Foundation is chartered in law, so they exist because Congress asked them to exist. And they are doing work in alignment with the CDC mission, right, to protect the health of this country. Though they do have a separate board and independent way of raising dollars and act independently from us. So we are trying to accomplish the same mission of protecting health.
But I think it's fair to say that you can assure us that you will not allow any donations from individuals to the foundation to affect your sound decisions in making decisions as the head of the CDC. Yes or no?
I will continue to make sure that I'm making decisions on behalf of the CDC that are in accordance with the data and the evidence.
Perfect.
From our.
I got to move on because time is limited even for the chair of the sub. So, Dr. Cohen, since you have become the CDC director, the level of cooperation from the CDC in response to this committee's oversight has been a little bit disappointing. CDC specifically has not responded to certain letters. Instead, we've received letters signed by HHS Assistant Secretary for Legislation. Even these responses did not respond to all of our questions or provide a single document. Instead, the responses recounted publicly available information. Under your leadership, as you get your sea legs under you, I hope that CDC will work with us to do our role as oversight. Will you commit to working with us and having the CDC cooperate with our oversight for the betterment of the nation? Yes or no?
Chairman, I look forward to working with you. I think it's really important, as I said in my opening statement, that we work closely with Congress, and I look forward to working with you personally. I built relationships across the aisle in North Carolina. I look forward to doing that here in this new role.
Yes, ma'am. Thank you. With the current surge in respiratory disease in China, this subcommittee sent a letter to you just yesterday, so we don't expect an answer yet, but just yesterday regarding this mysterious uptick in cases. Our hope is that, and if you need us to help, we will, but we are hoping that you can put some pressure in an attempt to try to get China to not mislead the world as they did with COVID-19. What steps is your agency taking, is CDC taking, to ensure that you can gather all the complete and accurate data regarding this mysterious uptick in respiratory illnesses in China?
Well, thank you, Chairman. On that, obviously, it is really important that CDC continues to do our global work and do this scientific diplomacy. What we know as of right now, today, of what's happening in China, they are having an increase in some of their respiratory illness. They're seeing it in the northern part of their country. They're seeing an uptick in their pediatric population. What we do know as of today is we do not believe this is a new or novel pathogen. We believe this is all existing, meaning COVID, flu, RSV, mycoplasma, but they are seeing an upsurgence. We do have an office, CDC does, in China, and our officials have been in touch with our counterparts to make sure that we're understanding the situation there. They were sharing back with us, again, not a novel pathogen.
And you'll keep us informed.
We will.
I appreciate that.
Thank you.
According to conversations the Select Committee on China had with local officials of Reedley, California, the CDC refused to take phone calls from city and county officials about that biolab. Why wouldn't the CDC prioritize a call on a serious and potentially deadly issue?
Chairman, we take very seriously working with our state and local partners. We work very closely and collaboratively. And I know in this case, when we did not lead the investigation, but when we were invited to join and investigate related to select agents at that lab, we did so. We went on site for 2.5 days and completed that investigation.
Well, what can you tell me about this Ebola refrigerator?
So we did a 2.5-day investigation. We took 300 photos, looked at everything. Our team did not see anything that said Ebola anywhere. Okay. When we heard after the fact that someone said it was labeled Ebola, we immediately followed up and said, do you have a picture? Is there any evidence? Could not produce that. So I think that was an erroneous inclusion in that report. We do not believe that there was any select agents on premises at that level.
Well, it's a dangerous world. Be careful out there. I yield back.